week's handout, I know you guys have already got it. Rose sent that out a little early, but that's okay. If you've printed it out, you got it there. You can see our mentions. A little tip I want to show you guys is something that I do when I work in the homes. And I use these colored dots. I use these colored dots here. Sometimes with folks that have particular issues with their gait, right? Maybe their gait length is shortened for whatever reason. So I like to use these dots. I'll use yellow. Yellow is a good bright color. So we have yellow and orange here, all right? And so what I like to do is whenever we're in our position of confidence, right? We've been in our position of confidence. That's a split stance where we're 95 to 100% confident that we're not going to fall. Now we can add all kind of variables here, such as moving our arms. We can move our arms on the transverse plane, on the sagittal plane, right? And that adds a bit of a variable, makes this stance a bit harder. I can also close my eyes. Once I become very efficient, I want to extend and get better at my balance, so I constantly need to challenge myself, hence the variables. So what I do is I'll use these dots, and I'll have folks put one foot on one dot and one foot on the other. And we'll just continually slide that dot out. And what we'll do is we'll start with our feet side by side, and we'll step. And it takes a lot of strength. You don't realize how much strength this takes. Some people, it's really difficult to push themselves back. But if you yourself or you have a loved one that is struggling with their balance, using dots gives them a visual cue on where to land their foot, all right? Now, when we do this too, there's some issues that can come into play, such as neuropathy, okay? And I'm seeing more and more neuropathy in women than men, which is unusual, or what I thought was unusual, according to my friend. He's a physician here in Naples. He says, you know, that's what we're seeing a lot of too. So the way neuropathy impacts balance is it affects the nerves in our legs, right? Particularly our feet. We have mechanoreceptors at the bottom of our feet that can detect pressure. So as I lean to my left here, I have mechanoreceptors, these nerves in my feet that send signals to my brain. My brain tells the muscles which muscles to contract so I don't go all the way over, and vice versa. So these nerve endings can be impacted by neuropathy. It can also be impacted by the shoes we wear, right? And if we're wearing big cushiony shoes or we have orthotics, the nerve endings or mechanoreceptors in the bottom of our feet are landing inside our shoe and not necessarily flat on the ground. And the way our foot lands and lays in our shoe can be quite different than the way it really lands on the ground. For instance, if you have an arch that's falling, or you have flat feet and you put an orthotic in your shoe to keep your arch, right? So versus how that foot lands in the shoe versus the floor can make an impact too. You want to practice your balance with your shoes off if you can. Now don't go walking around Target with your shoes off, especially these days. But certainly if you're at home and you're working on your balance, you want to take your shoes off, okay? All right. Now, let's get going.